Hey everybody, my name is Jeremy Newman. I'm the recreation therapist over the CLC, or the Community Living Center. This is a 3-floor building now. It's only has the top floor has our 3 different units that house the CLC. You can see that it's a busy place. There's lots of things going on, including short-term rehab, long-term rehab, and a palliative care unit. So I'm over the short-term rehab and also the long-term rehab. I'm also acting as Alice Smith's intern. We do enjoy having students come and experience all the things we have here for our veterans, and to learn the diverse aspects of recreation therapy. What we do here in the community center is provide activities for patients to do when they're not doing anything. So as a recreation therapist in the community center, we're responsible for the activities that they do in their free time, as well as the therapeutic activities that we provide. For example, in our office here, we have all kinds of resources for self-directed activity, like reading books or listening to music or doing puzzles or putting together crafts, and we keep all of our supplies in the office there. We also do activities together. So as a group, they might have bingo or blackjack, so we also include group activities that we do together as a group. That makes sense, huh? We go on outings. Florida is close by, so we do a lot of gator games, baseball, volleyball, basketball, whatever we can get wheelchairs into. We also do other activities together, like I said, blackjack and bingo, and coffee groups and cooking groups. We keep a calendar on the billboard here all the time. Usually it's bigger than that. But just to help people know what's going on in their day, when they have some free time, they can join us. We also do therapeutic activities. One thing that Alice has been helping me with is the weed activities that we do with our patients. It helps them stay active. This is the area that we use to do Wii bowling or Wii boxing. The computer game is really nice because it allows us to be able to include anybody and adapt to their needs. We use the big TV down there. We've also got a shuffleboard that's accessible by wheelchair. And in here you can see there's a kitchen here. We have a cooking group. And you can see that all the counters and tables are wheelchair accessible. Behind you there we have resources for entertainment and also quiet time if there's someone who likes to read or play a game. As therapists here, we kind of have a dual role in the community center, not only for diversion but also for therapy. We may provide things for people to do for fun, but we also follow the direction of a primary doctor, where they'll instruct us what activities they want us to use to help in the rehab. We already mentioned the Wii. We also refer people to Paul Smith for the Aquatic Therapy and for the fitness programs. We also can adapt an activity with other disciplines, like physical therapy and occupational therapy. We can do joint treatment together. The Wii is a good example of that. We can also use the gardens out here outside. I don't know if you can see them through the blinds, but we have gardens all around the outside of the building. They're wheelchair accessible with tables where we grow food, and we also grow flowers and more botanical plants. And those that enjoy those kind of activities can participate. So as a recreation therapist, I was taught I actually graduated from BYU, Brigham Young University, and there they taught us that any activity can be adapted to serve the needs of a patient or just to have fun and provide social support. So let's come to the office and I'll show you one of the activities that I did today. This afternoon we had a small blackjack activity. So this is our office here. We keep all of our resources here. It might be a little bit disorganized right now, but Alice helps us keep it clean. Anyway, as I was saying, one of the activities that we did was blackjack. And this is the blackjack box that we keep all of our supplies in. But as you can see, we keep a deck of cards and some chips to use for, we don't gamble, but it just helps us keep track of who's ahead and who's behind, and then we provide a prize at the end to the winner. But as you can see, you have several things to work with. So if I was providing an activity for social support, I might, make it a little more fun, a little more loose. If I'm working on some therapy with a patient, there may be someone with a stroke that has a left-sided weakness or neglect, and I might place the cards or the chips on that side and have them practice using that weak side, and even learning how to adapt. And there may be some cognitive deficits where I'm actually having them count the cards and make sure that they're below 21 still, and so that they can play the game accurately. I may use it for social therapy. So if someone's got PTSD or anxiety, social anxiety, I might have them sit close to some of the more friendly guys and help them to see that they're safe, that they can participate in activities successfully with other people, and that it might be actually supportive to them to help them get out of their rooms and not be secluded and alone.
Good afternoon, everyone. I'm Paul Smith, staff recreation therapist here at the Gainesville, Florida Veterans Hospital. And as you can see here, we're in one of our clinics, which is the Aquatic Clinic, which is an area that I'm assigned in addition to the land-based fitness clinic. So here at Aquatics, obviously based on the chair lift, when you think about recreation therapy, you're talking about trying to get individuals back to a level of best independent functioning as possible. And so certainly the water is a level playing field where we have a variety of disabilities, from spinal cord, stroke, pain, obesity, a lot of your metabolic diseases. And so we have the lift here if necessary. If you come around here, we can show we have the ramp. So that's where most of our veterans would enter safely with the handrails. And what happens, we have a nice little outline there. Elvis, I don't know if you can pick it up, but there is a kind of a pool structured outline curriculum. But what we try to do is obviously we're going to make it individualized, again, to bring about the best possible outcome for the patient. And so the majority of the folks are going to come in. They're going to do some dynamic walking, forward, sidestepping, a little backward walking. There's a variety of stretches and some static, called static stretches, so they're holding those positions for a 10 count. We also have the parallel bars here, so individuals who may not have the ability to walk out in the open water, we use the parallel bars so that they can ambulate independently within those. Over here, we have our what we call our hydrotones. So they are basically a water dumbbell. So to not negate the upper body, we'll take individuals through a series of upper body strength, range of motion exercises using these. When held under the water, create resistance. The benefit of the water, it has the three properties that are very prominent for rehabilitation. In that, number one, it's heated. Number two, when you're in the water, you're getting pressure. Now, you're not feeling that pressure as if you were going to the bottom of the ocean, but just because you're submersed, you're feeling that pressure. You're also not bearing a lot of body weight, so that allows for folks who do have some skeletal muscle pain issues or soreness. It kind of alleviates that. And the other thing is, when you're moving in the water, naturally now you're creating good circulation. So those folks who do have some of those metabolic diseases, such as the ones we discussed, hypertension, obesity, arthritis, okay? So in a nutshell, it's a great modality, and we hope you enjoy this. And,
hey, Mr. Smith,
yes.
Can you tell me what does recreational therapy mean to you?
Well, I think I kind of hit on it in the beginning. what I look at recreation therapy is you're taking modalities like that. You're trying to bring someone back to a level of best independent functioning, past enjoyed, maybe leisure activities. And you know, I think that that's really what we're trying to strive, is that through recreation activities, it doesn't mean that my life has to no longer be fun, that I can still engage in the things that I enjoyed maybe before I had some type of disability or disease.
Please introduce yourself.
Hi, my name is Paula Pringle. I'm an inpatient recreational therapist here at the Gainesville VA Inpatient Psychiatry.
So, Mrs. Pringle, what does recreational therapy mean to you? And please, if you could, tell me some of your qualifications.
Yes, I'm a 1994 graduate of the University of Florida. Go Gators! Anyway, so with the program here, recreational therapy to me is bringing life to our patients who struggle from depression, anxiety, schizophrenia, or where they're recovering from substance abuse. And we use a variety of modalities to help increase their self-esteem, their leisure awareness, as well as coping skills that will assist them when they're discharged.
So, Mrs. Pringle, take me through your day as a recreational therapist.
Okay, so our unit houses about 25 patients each. We have patients that are all veterans, and they range from ages as young as 21 up to 90.
Okay.
This is what our unit looks like. So all of our rooms are individual. We have group rooms on the unit. Our diagnoses range from anxiety, depression, schizophrenia, PTSD.
Okay.
On our other side, even though it's substance abuse, you still may see those same diagnoses come across, because we know that a lot of diagnoses live together. So they may be depressed, but they also may have a drinking issue that goes alongside that.
Hello, my name is Matt Leach. I'm a recreation therapist here at the VA Medical Center in Gainesville. I work in our medically supervised fitness and aquatic therapy program. And actually, we can come in here and take a look real quick. At our clinic here, we see quite a variety of patients with different disabilities and chronic illness. It's all based off a doctor's consultation to use this facility, and obviously myself and a couple other therapists oversee the facility. So we do some general strength and conditioning exercises in here. We have some treadmills. Over here we have some seated ellipticals, exercise bikes, and over here we have a couple arm ergometers. Given the variety of patients that we see here, some folks have very limited mobility and may not be able to do a treadmill, maybe required due to pain or poor mobility, have to do a seated elliptical or maybe even an arm ergometer. Around the outside of the clinic here with the blue pads, if you can see, that's our strength line. We have about 10 or 11 strength exercises, strength machines that are just designed to hit all of our main muscle groups here. We do have some free weights there, as well as some TRX material here as well, so we can do some suspension training with our patients that are able. So that's kind of our clinic here, in addition to the aquatic therapy program that you will see at the pool as well.
So, Mr. Leach, what does recreational therapy mean to you?
To me, it's pretty simple. It's using leisure and recreational modalities to help our patients gain function, gain independence, get better at ADLs, and just improve quality of life. So part of the process of us treating patients here at the fitness clinic or aquatic therapy clinic requires a doctor's consultation. So with that said, we would receive it. We would contact that patient to come do a formal evaluation. We'll in the meantime do a formal chart review, get the patient in here, introduce the clinic to them, and get some kind of baseline information on their fitness level, abilities and disabilities. So I could start over here. We generally start by taking some biometrics, height, weight, body fat, BMI, stuff like that, blood pressures over here. And then we would typically do a cardiovascular assessment, usually a 6-minute walk test or some sort of 6-minute cardiovascular exercise. Could be a hand bike, again for folks with poor mobility, or maybe they're an amputee, or even a seated elliptical or a bicycle. And then we would continue with showing them some of the strength equipment, adapting them to the program. Part of our job is to really individualize a routine or a fitness exercise program to fit their abilities and disabilities, and to help them achieve their goals, whether it be physical or even psychological, or goals that most folks don't think about, like lowering their blood pressure, lowering their heart rate, controlling diabetes, or just for maintenance of chronic metabolic or cardiovascular disease.
My name is Regina Riley. I got my undergrad degree from the University of Southern Mississippi in Recreational Therapy. The two populations that I work with here are substance abuse and palliative care.
So Mrs. Riley, what does recreational therapy mean to you?
Recreational therapy means to me, it's a means of using recreation, leisure, and play to cope with one's psychological, mental, or physical, emotional disabilities that they may have.
Mrs. Riley, describe some of your daily tasks that you complete as a recreational therapist.
As a recreational therapist in the substance abuse population, I utilize several different means to help with recovery. With substance abuse, you may have veterans that range from early 20s to in their late 60s or 70s. Some of the activities that I use are community reintegration, so taking the guys out into the community, letting them see resources that are available as far as in the Gainesville area or local or surrounding areas. I also do recreational activities or leisure activities just to give them an idea of different things that they can do in their leisure time. Because one of the first things to go whenever you're dealing with a substance abuse or an addiction problem is the leisure time. Substance abuse and addiction tend to take over a lot of one's life. Other things that I do with my substance abuse population may be physical fitness, so taking them to the gym, teaching them how to work out healthy, or showing them different things that they can do. And then I also do a class that's there at the location that they're at, which kind of shows them different things that they can do outside of a gym, whether it be TheraBands, whether it be relaxation techniques, or just stretching exercises.
Hi, my name is John McCula. I'm a recreation therapy supervisor at the Gainesville VA in Gainesville, Florida. I'm going to talk with you a little bit today about recreational therapy. My personal background is I graduated with a bachelor's degree in Therapeutic Recreation from Southern Illinois University in 1998. I've since followed up with a master's degree in physical education from the University of South Florida. I'm also a certified exercise physiologist through the American College of Sports Medicine. Currently, I oversee several areas of recreation therapy here performed at the hospital. My area that I specialize in is medical fitness and aquatic therapy, but I also see areas such as substance abuse, homeless program, the community living center, and palliative care center, and inpatient psychiatry, as well as substance abuse. So what's a typical day like for a recreation therapist? Well, delivering recreation therapy services to patients throughout the hospital. Here we specialize in different areas. We'll take it a little step further. What's a day like in the life of a supervisor for a recreation therapy department? Well, for myself, it's really taken me quite a long time, about 15 years, to get to this level of practice. That's being a supervisory therapist. So that entails me working roughly about half-time as a clinician and half-time as a therapist, overseeing this group of clinicians. What I oversee is the administration role of recreation therapy. I oversee the guidelines of how we practice recreation therapy and monitor the quality of our services. Now, for recreation therapy in the VA, really we're going to look at a therapy that's kind of evolved out of probably around World War II, around 1945 was when the recreation service was established in the VA. From there, recreation therapy really has continued to grow, not only in the VA, but in the private sector as well. Today, because of the conflicts in Iraq and Afghanistan, and the younger military population, we're seeing a little change in recreation therapy service to that of more of an active therapy population, such as today some of the more common modalities that we use are adaptive sports, taking sporting activities and adapting them for a therapeutic purpose to meet the skills and abilities of the veterans that we serve. We also are charged today with really increasing and promoting the health and well-being and fitness of the veterans that we serve. So this involves using more fitness type modalities such as aquatics, weightlifting, and endurance activities. Again, I mentioned adaptive sports and games and things of that nature. In many settings in the past, recreation therapists often employed more sit-down, more somewhat passive modalities, but today we're seeing a shift again to more active type therapy. For example, the inclusion of activities such as Tai Chi, which is newer, I think, in the therapeutic realm as being a modality, today is becoming pretty prevalent. And so that's really an overview of recreation therapy from a supervisor's perspective. Give you a little bit of a view of what it's like a day in the life of a supervisor, but also I think the well-roundedness that it might take to become a supervisor, such as attaining a master's degree, attaining various additional competencies that along the line can promote yourself as a clinician. So I hope that's helpful.
In this video, do not speak on behalf of the Department of Veteran Affairs and do not represent the federal government in any capacity speaking on their own behalf. No fees, pay, or royalties were paid for appearing in this video.